Hi, I'm Michael Ches. I'm a pediatric epileptologist and child neurologist in the Sacramento, California area, and I've been asked by the Lennox-Gastaut Foundation to talk to you today about Epidiolex, which is an FDA-approved cannabidiol. Epidiolex is right now the only FDA-approved cannabidiol product. It's approved for Dravet and Lennox-Gastaut syndrome, and also for use as an add-on medicine in tuberous sclerosis. The product has been shown to be increased in efficacy when used with clobazam or other benzodiazepines like clonazepam, because these two interact because they inhibit some of the metabolism, and so they both increase each other's levels. In Dravet syndrome and Lennox-Gastaut syndrome, there is decreased drop attacks and convulsive seizures, and in tuberous sclerosis complex, there was both convulsive and focal seizures of generalized and focal nature that were treated, including some who had Lennox-Gastaut as an overlap. As with many anti-seizure medications, the exact site and mechanisms of action are unclear, but we know that it doesn't work with typical cannabis receptors such as the THC receptor, which makes people high. And again, this product is very purified so that there's essentially no biologically useful THC in it. It works on CAMP and calcium channels, and it may stabilize membranes of the neurons and the synaptic area, among other theoretical ways of which it works, but it doesn't work directly at typical neuroreceptors such as GABA or NMDA or other similar receptors. It doesn't work on sodium or potassium channels, for instance, and it doesn't work directly on calcium channels per se. So this is an interesting drug because it may have some anti-inflammatory effect and it may work in non-specific ways over time. One thing it is not is a rescue medicine, and if you take it acutely, it will not stop your seizures just because you take it under your tongue or spray it in your mouth, which some of the non-approved products make claims of. So you need to understand that to use cannabidiol in epilepsy, it's a chronic, build up the levels and get it to work with the other drugs to have an effect on dropping the seizure frequency. It usually works within 2 weeks to 3 weeks, and it is effective in these conditions in reducing the frequency of the seizure burden. Now, you have to be cautious when you're using it with the most common medicines used in Dravet and Lennox-Gastaut, because when it's used in combination with valproic acid, also known as Depakine or Depakote, or clobazam, you need to understand that these drugs do interact a little bit, and there's an increased risk of liver enzyme elevation to more than 3 times normal in a small percentage of patients who are on this. So it's recommended then when you take Epidiolex that you check the liver functions, because even Epidiolex alone can cause this. And you check the liver functions at baseline, and then at 1 month, and then every 3 months, and then every 6 months after the first 6 months to make sure that the liver functions are fine. It's usually seen early in the treatment if it's going to happen, and reducing the Epidiolex or the other drugs usually improves this. It's not been anything that's been a permanent liver effect, but you have to be aware of this. And this would apply to any over-the-counter or boutique CBD products in combination with these medications commonly used in Lennox-Gastaut. A lot of the problem that we worry about as physicians is that people go to non-physicians for supplying them with non-approved CBD products. And these products that you get on the internet or from a dispensary or from a friend don't warn you about the liver effects. So if you are using those products, please make sure you talk to your doctor about liver safety if you are taking it in combination with the typical drugs used for Lennox-Gastaut. Obviously, clobazam has an effect with Epidiolex, and it increases the amount of clobazam so that you can get the metabolites of CBD are increased as well as the metabolites of clobazam. And so both of their byproducts last 30 days. So if you make rapid increases to either of these drugs, you may have an effect where you get toxic on the medication. So you want to go slowly and increase Epidiolex in combination with clobazam every 2 weeks or slower, so that you know that you're not overdoing it when the byproducts start to build up. It's related to the benzodiazepine family, so things like Valium, clonazepam or Klonopin, Ativan, they will also increase in combination with use with Epidiolex. And so you want to be careful when using these in combination. Okay, so in summary, Epidiolex is a useful drug approved for use by the FDA for Dravet syndrome, Lennox-Gastaut syndrome, and tuberous sclerosis complex, and that it can help multiple types of seizures, most typically the non-absence type seizures, I should say, more the convulsive drop attacks, atonic seizures, tonic seizures, convulsive seizures like hemiclonic or tonic-clonic seizures. And thank you for listening, and I hope this was helpful in informing you about the benefits and risks of using this valuable product for Lennox-Gastaut and Dravet syndrome.